Hey, welcome everyone. Thank you so much for joining me. My name is Megan Ferrara, and today I will be sharing about music therapy. So just to get started, I'd like to share a little bit about myself. I was born and raised in Phoenix, Arizona. I'm a desert girl, but I came up to Utah State University in 2019 for the music therapy program, and will be completing my program in 2023. My primary instrument is piano. I started lessons when I was very young and then started teaching piano lessons when I was in middle school. Currently, I work with adolescents. I've been working in a school for at-risk youth for about 4 years. And when I'm not making music, I love to be outside playing sports and baking lots of yummy things. So I want to share a little bit about my clinical experience. So my first practicum experience was with Overly Musical with the Play With Me music group, and this was such a fun group of young children ages 0 to 5 and their caregivers. In the spring of 2022, I was at Franklin County Medical Center, and I worked with a group of adults with various developmental disabilities. Then I transitioned to something different. I was with the memory care group at Birch Creek Assisted Living, and I worked with a group of older adults with mild to severe memory loss. And then my most recent practicum experience is in spring of 2023, and I have been working with Able Minds Music Therapy, working one-on-one with a child with autism. So my philosophy for music therapy and really for life, I truly believe that we want to connect. I believe that one of the fundamental human desires is to connect with others. I think we have this innate desire to form meaningful relationships with others. However, this can often be challenging for those who struggle with building relationships and socializing with others. As a future music therapist, my goal is to provide opportunities for clients to build meaningful relationships with others and develop confidence in themselves through music. So what exactly is music therapy? Music therapy is defined as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So I want you to kind of take a look at some of those bolded and underlined words. Clinical, evidence-based, we're going to come back to those. So what does it take to become a music therapist? Music therapists complete a bachelor's degree or equivalency program from an approved AMTA music therapy program. This program includes rigorous courses in music history, music theory, music therapy, psychology, human development, as well as private music instruction. Music therapy students are required to achieve proficiency in piano, guitar, voice, and a variety of other instruments. After the undergraduate program, music therapy students are required to complete 1,200 clinical hours as part of a 6 or more month internship. And then after the internship, music therapists must complete the CBMT board certification exam. So I told you we'd come back to this evidence-based practice. So music therapy focuses on providing care based on the current research and practice. It's really important that music therapists rely on current research so that they can provide the best care for their clients. There's a lot of different journals that have been published with various music therapy articles and case studies. So I've just included a few here. There's the Journal of Music Therapy and Music Therapy Perspectives, and those are both published through the American Music Therapy Association. So why music therapy? What makes music therapy different from, let's say, music performance or music education? So music therapy is focused on addressing specific non-musical goals. So for example, a music therapist might be making music with clients, but the goal might be to practice socialization or practice turn taking, color identification, different things like that. Whereas music performance is typically focused on entertainment. So music therapy requires, of course, a board-certified music therapist, and involves musical intervention. So sometimes when we see these musical interventions, they might look like entertainment or fun, and don't get me wrong, they are lots of fun, can be really engaging. However, what really sets it apart is the fact that music therapy is focused on those goals and objectives that are specific to the client. Music performance and music education is typically focused with children and adolescents, usually when students have the most musical education is typically in their childhood, where they try learning an instrument or make music at school through band programs or choir programs. Music therapy, on the other hand, is used with very diverse populations, anywhere from early childhood and even earlier in NICU, or at the end of life. Music therapy can be interactive or it can be receptive. I think the main point here is that music therapy focuses on using music to help individuals improve in cognitive, physical, emotional, and social domains. So going back to those specific goals. So I want to take some time to talk about music therapy in memory care and what music therapy looks like with older adult populations. So let's talk a little bit about memory. So you've probably heard the term dementia. Dementia is actually an umbrella term for many different conditions that affect memory, as well as other areas of cognition. So you may be familiar with Alzheimer's disease. That is a very prominent form of dementia. However, there are lots of other forms of dementia as well. So people with dementia often grow increasingly dependent on others as they experience cognitive decline. This decline affects not only cognition, but also social initiative, autonomy, and overall quality of life. Older adults with dementia often struggle to initiate and form meaningful relationships with others, and it can be really frustrating when you're trying to make connections, but you're not able to really retain that information and retain the things that you're trying to build. We know that music has a powerful ability to evoke strong emotions and memories. If you think of your favorite song, you can probably think of a memory associated with it. Maybe the first time you heard that song, or where you were, or who you were with at that time. Certain musical elements, such as pitch, rhythm, and form, can be processed and remembered in the brain much longer than other stimuli. So when older adults with dementia begin to lose those neural pathways, music stays much longer, we have found. So what does music therapy look like in memory care? Some goals that might be addressed are increasing socialization. We kind of talked about that component. It can be really beneficial to have individuals come together, especially in an assisted living facility or a residential facility. Individuals are usually in their rooms most of the day, and so it's really great to get them out together making music. Music therapy can also be a very powerful way to promote reminiscence. We talked about this a little bit, but being able to connect a song with a certain memory can be very powerful. Some other goals might be to increase fine and gross motor skills, increase reality orientation. Reality orientation is just an awareness of the current space and time. So knowing what month it is, knowing what time of year, what season it is, those all go into that component. Music therapy can also be to promote positive quality of life and to promote self-expression. Again, allowing these older adults to practice autonomy, being able to express themselves in settings where they may not easily be able to do so. And with this, I just want to note that goals are always based upon client needs. And we are always conducting ongoing assessment and evaluation throughout the treatment process to make sure that the interventions are meeting those goals. Some interventions that you might use in memory care, some are instrument play, movement and music, songwriting, lyric analysis, guided relaxation, or improvisation. So I'd like to share some examples of some interventions that I used when I was working with a group of older adults in memory care. So this was a really fun intervention that we did. We typically chose a theme for each session, and the theme for this particular session was sports. And so of course we thought of Take Me Out to the Ball Game. The goals for this intervention were to promote reminiscence and increase motor movement. For this intervention, we collected a bunch of different sports balls and put them in a large basket. So we had anywhere from basketballs, footballs, soccer balls, tennis balls. We had a golf ball in there. And we started by singing the song. So we have found that typically when you introduce the song first, that can help clients to identify, recognize, and recall that song. And then they're able to sing along when they're ready. So after this, we had each resident choose a sports ball from the basket. And we kind of started a discussion about, have you ever played this sport before? And we just heard the most amazing stories. And then we sang the song again and replaced the lyrics with the ball that they had. So it was a lot of fun. It was great to hear their sweet memories of being outside, being with friends and family. Another intervention that I'd like to share with you, if you don't mind, is an intervention we did with Lean On Me. The goal of this intervention is to promote reminiscence and increase socialization. So you probably know this song. And as I sing it, I'd like to invite you to think about the people in your life that you rely on every day and the people that you care about. Sometimes in our lives, we all have pain, we all have sorrows, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. So that's just one intervention that we did with our residents to help them to think about those people in their lives that they rely on. So here are some awesome references if you'd like to do a little bit more research on the topic. And then if you have any questions, feel free to reach out. I'd love to chat. I'd love to help answer any questions you might have. So thank you so much.